An experienced nurse precepts a graduate nurse caring for a hospitalized client who has a prescription for a transfusion of packed red blood cells (RBCs) to be hung over 3 hours. Which statement by the graduate nurse indicates the correct rationale for asking the client to void prior to starting the transfusion? A drop in blood pressure is expected during the transfusion, and getting up to void may cause a fall. Bed rest is required, therefore, voiding will prevent intermittent catheterization during the procedure. If a transfusion reaction occurs, it will be important to collect a fresh urine specimen to check for hemolyzed RBCs. The urine is collected and analyzed prior to starting the transfusion to assess the client's baseline results. The nurse should ask the client to void or empty the urinary catheter and discard urine prior to starting a blood transfusion. In the event of an acute hemolytic transfusion reaction, a fresh urine specimen should be collected and sent to the laboratory to analyze for hemolyzed RBCs. An acute hemolytic transfusion reaction is a life-threatening reaction in which the host's antibodies rapidly destroy the transfused RBCs and is generally related to incompatibility. Early signs of a hemolytic reaction include red urine, fever, and hypotension. Late signs include disseminated intravascular coagulation and hypovolemic shock. The transfusion should be stopped immediately if any sign of transfusion reaction occurs. Starting the transfusion with an empty bladder will help ensure that any urine specimen collected after a reaction is reflective of the body's physiological processes after the blood transfusion has started. Option 4. Options 1 and 2. Hypotension is a sign of a transfusion reaction and is not expected. Bed rest is not required, but the client should be assisted if out of bed during a transfusion to prevent falls. Educational objective: an acute hemolytic transfusion reaction is a life-threatening reaction caused primarily by blood incompatibility. If it occurs, the transfusion should be stopped and a fresh urine specimen should be collected and sent to the laboratory to analyze for hemolyzed RBCs. Asking the client to void prior to starting the transfusion helps ensure that any urine specimen collected after a reaction is reflective of the body's physiological processes after the blood transfusion. The nurse provides teaching for a client newly prescribed disulfiram for alcohol abstinence. Which information is the priority for the nurse to include? Disulfiram is not a cure for alcoholism. Importance of continuing to see a therapist. List of everyday items containing hidden alcohol. Medical alert bracelet should identify disulfiram therapy. Disulfiram abuse is a form of aversion therapy that promotes abstinence from alcohol. If the client consumes alcohol while taking disulfiram, unpleasant side effects e.g., headache, intense nausea, vomiting, flushed skin, sweating, dyspnea, confusion, tachycardia, hypotension can occur. If large amounts are consumed, the reaction can be fatal. Disulfiram therapy does not cure alcoholism. The client should continue seeing a therapist. Options 1 and 2. Due to the hazards of treatment, clients are carefully selected for disulfiram therapy, and informed consent is often required. It is a priority for the nurse to educate the client about the hazards of drinking alcohol and about sources of hidden alcohol. Option 3. Teaching includes: avoid hidden alcohol in liquid cold and cough medications, aftershave lotions, colognes, and mouthwashes, foods such as sauces, vinegars, and flavor extracts. Abstain from alcohol for 2 weeks after the last dose, as the disulfiram reaction could still occur. Wear a bracelet alerting others of being on disulfiram therapy. Option 4. Educational objective. Disulfiram is a medication that promotes abstinence from alcohol by causing uncomfortable, potentially fatal reactions when alcohol is consumed. Clients must avoid sources of hidden alcohol, e.g., liquid cough med. The charge nurse in the emergency department assigns the client to a new nurse who has been off orientation for a week. Which client assignment is most appropriate? 3-year-old with a temperature of 102.4 F 39.1 C, who had a seizure at home 30 minutes ago and is very irritable. 8-year-old with a closed fracture of the clavicle following a fall, who is talkative and rates pain as a 2 on the 0 to 10 faces pain scale. 32-year-old with asthma who has an upper respiratory tract infection and a peak expiratory flow rate that is 45% of personal best. 72-year-old prescribed antibiotics 3 days ago to treat acute sinusitis who reports shortness of breath and has a rash. A fractured clavicle collarbone is not uncommon in children aged less than 10 years and is usually treated conservatively. A new nurse should be competent in performing the basic skills needed to care for a client with a musculoskeletal injury, e.g. pain and neurovascular assessments, analgesia administration, sling application. The 8-year-old client, who has minimal pain as indicated by the score of 2 on the FACES pain assessment tool, is the most stable. As a result, this is the most appropriate assignment for the new nurse. Option 1. A seizure can be associated with a fever-related illness, febrile seizure. This client who is very irritable and has fever may have an underlying serious infection such as meningitis and should undergo diagnostic testing, e.g., blood cultures, imaging, lumbar puncture. Therefore, this is not an appropriate assignment. Option 3. A peak flow meter measures airflow out of the lungs. The client who has a severely reduced peak expiratory flow rate less than 50% of personal best needs emergency intervention and is not an appropriate assignment. Option 4. The client with dyspnea and a maculopapular drug rash is most likely experiencing an antibiotic-related allergic reaction, which can range from mild to life-threatening anaphylaxis. This client is not an appropriate assignment. Educational objective: a new nurse should be competent in performing the basic skills needed to care for a client with a musculoskeletal injury, e.g. pain and neurovascular assessments. An elderly war veteran with prostate cancer and coronary artery disease is hospitalized for urosepsis. The client becomes angry with the unlicensed assistive personnel (UAP) who is trying to help the client bathe. Later, the UAP expresses frustration with the client to the registered nurse. Which statement would be the most appropriate response? I'll talk with the client to see why the client is angry. It sounds like you shouldn't work with this client, so I will reassign you. Let's go together to ask about the client's concerns. Why don't you go talk with the client about why the client is angry? Anger is often a sign of psychological distress stemming from anxiety, fear, or loss of control. This elderly veteran has likely had lifelong control. Now, with worsening health issues and an acute illness, the client has lost control, causing anger. The feelings are probably accentuated by hospitalization and by staff such as the UAP trying to do things for the client that the client could do alone. A client who is angry should be given the opportunity to express concerns openly. It is important to approach the conversation with an open, accepting, non-judgmental attitude. The nurse can show the UAP how to deal with these issues. The UAP plays an important role in developing an interdisciplinary plan of care for hygiene and activities of daily living, ADLs, that the client will accept. Therefore, the nurse and the UAP should go together to learn about the client's concerns. They can then work with the client to create a plan for hygiene and ADLs that will allow the client more control while ensuring safety and quality care. Option 3. Option 1. This is a team problem, so the nurse should seek a solution that includes the UAP, who can contribute to the solution and will learn from the process. Option 2. Reassigning the UAP will not address the client's concern, and the client may get angry with other staff. Option 4. This situation will require skilled communication and an empathetic approach, which the UAP is probably not ready to handle alone. Educational objective. Anger is often a symptom of psychological distress associated with anxiety, fear, or loss of control. An appropriate response to an angry client is to listen with an open, accepting attitude, and collaborate with the client and other staff to create a care plan that addresses psychological and physical needs. The nurse cares for a client with Addison's disease who was involved in a motor vehicle accident and hospitalized for a fracture of the right femur. Which client information is most important to report to the primary healthcare provider? PHCP. Blood pressure change from 128/80ths of a millimeter Hg to 90/50ths of a millimeter Hg. Development of a first-degree atrioventricular (AV) block on electrocardiogram (ECG). Reports of right femur pain of 7 on a scale of 1 to 10. Vesicular breath sounds auscultated over the lung tissue. Addison's disease is adrenocortical insufficiency or hypofunction of the adrenal cortex. A deficiency in all three classes of adrenal corticosteroids, including glucocorticoids, mineralocorticoids, and androgens, is present in Addison's disease. Addisonian crisis, or acute adrenocortical insufficiency, is a potentially life-threatening complication of Addison's disease. It can lead to shock and should be reported immediately to the PHCP. Addisonian crisis is triggered by stress, and its manifestations include the following: hypotension and tachycardia, dehydration, hyperkalemia and hyponatremia, hypoglycemia, fever, weakness, and confusion. Option 2. Although any new ECG changes should be assessed and investigated, this finding is typically non-consequential and is not life-threatening. Option 3. Although pain should be assessed carefully and managed, it is expected with a fractured femur and is not life-threatening. Option 4. Vesicular breath sounds auscultated over the lung tissue are a normal and expected finding. Educational objective. Addison's disease is adrenocortical insufficiency or hypofunction of the adrenal cortex. A potential life-threatening complication is Addisonian crisis. Signs and symptoms include hypotension, tachycardia, hyperkalemia, hyponatremia, hypoglycemia, fever, weakness, and confusion. These should be reported to the PHCP immediately. During assessment of a client who had major abdominal surgery a week ago, the nurse notes that the incision has dehisced and evisceration has occurred. The nurse stays with the client while another staff member gets sterile gauze and saline. How should the nurse position the client while waiting to cover the wound? Low Fowler's position with knees bent. Prone to prevent further evisceration. Side-lying lateral position. Supine with head of the bed flat. Wound evisceration is the protrusion of internal organs through the wall of an incision. It typically occurs 6 to 8 days after surgery and is more common in clients who have had abdominal surgery, those with poor wound healing, and those who are obese. It is considered a medical emergency. The nurse should remain with a client while calling for help. The healthcare provider should be notified immediately and supplies brought to the room by another staff member. The wound should be covered with sterile normal saline dressings. While the nurse remains in the room, the client should be positioned in Low Fowler's position with the knees bent. This position lessens abdominal tension on the suture line and can prevent further evisceration. The client should be prepared for immediate return to surgery. Option 2. Prone positioning would put undue pressure on an open incision and protruding bowel and could contaminate the open wound. Option 3. A side-lying lateral position, recovery position, is often used following emergency situations such as cardiac arrest or seizure. but it will not lessen the tension placed on this open wound. Option 4. Supine with the head of the bed flat may actually increase tension placed on the open wound. Educational objective: wound evisceration is a medical emergency. The client should be placed in low Fowler's position with the knees bent to reduce tension on the open wound. The nurse should remain with the client while another staff member obtains sterile saline and gauze to cover the wound. Exhibit. The nurse is in the medication room preparing medications due at 1800 for a client who had an aortic valve replacement 5 days ago. Which action should the nurse implement first? Click on the Exhibit button for additional information. Assess the client's most recent potassium level. Check the client's INR. Measure the client's vital signs. Verify the client's name and date of birth at the bedside. Warfarin, Coumadin, is an anticoagulant given to clients with a mechanical valve replacement. To determine if the client is receiving an appropriate dose, the INR needs to be checked regularly. A therapeutic INR for a client with a mechanical heart valve is 2.5 to 3.5. The nurse should not administer warfarin without checking the INR first. If the INR is greater than 3.5, the nurse should hold the dose and contact the healthcare provider for further direction. Option 1. Although the nurse should assess the client's potassium level prior to administering supplemental potassium, this medication was scheduled at 09:00 and is not indicated at this time. There is no pharmacologic interaction between potassium levels and warfarin. Option 3. The client's vital signs should be measured routinely, but administration of warfarin and simvastatin are not contingent on the results. Option 4. Verification of the client's name and date of birth is an important safety measure that should be performed at the bedside, immediately before medication administration. Educational objective: the nurse should check the client's most recent INR level prior to administering warfarin. A therapeutic INR is 2.5 to 3.5 for clients with mechanical heart valves. The nurse should hold the dose and contact the healthcare provider if the INR is greater than 3.5. The nurse has received report on 4 clients. Which client should the nurse see first? Client admitted this morning with acute pyelonephritis whose IV line is infiltrated. Client scheduled for surgery in 2 hours who has questions about the procedure. Client who had a colostomy yesterday and now has a leaking colostomy bag. Client with a total hip replacement 3 days ago who reports no bowel movement in 2 days. Acute pyelonephritis is a severe bacterial infection of the kidney that causes it to swell. It can lead to permanent scarring of the kidney and can be life-threatening. Initial treatment includes vigorous parenteral IV fluids and IV antibiotics. This client's needs are the priority as treatment is dependent on patent IV access. Option 2. A client scheduled for surgery who has questions about the procedure will need to speak to the healthcare provider, HCP. The nurse should arrange this as soon as possible as the surgery is scheduled in 2 hours. This client is the second priority. Option 3. A colostomy is a surgical opening, stoma, in the abdominal wall through which a section of large intestine is brought outside the body, either temporarily or permanently. A colostomy bag is placed over the stoma to collect stool. It is very important that the bag have a good fit and seal around the stoma to prevent skin breakdown due to leaking stool. The colostomy bag can leak if not emptied or cared for properly. This client needs assessment but is not a priority over the client with acute pyelonephritis. Option 4. The client who had a total hip replacement and reports no bowel movement for 2 days requires assessment. Postoperative pain medications often cause constipation, and client teaching about the importance of adequate fluid and fiber intake needs to be reinforced. The nurse should check the medical record for a prescription for a PRN stool softener, laxative, or enema. If it is not included, the nurse should contact the HCP for further instructions. Educational objective: clients with acute pyelonephritis require aggressive IV fluids and IV antibiotics to stop progression of the infection and kidney scarring. A patent IV line is the priority. The client screams at the nurse, "You are all incompetent here. I have been waiting for 2 hours." How should the nurse respond initially? "I know you are upset, but I will have to call security if you continue to scream. I see that you are frustrated, but the delay cannot be avoided. It is upsetting to wait so long. How can I best help you? The wait is long today, but you will receive quality, unhurried care when it is your turn." Therapeutic communication is used to establish trust, encourage communication, and display respect for the client. Validating the client's feelings and offering self-convey concern and understanding by the nurse and help establish a therapeutic dialogue. Option 3. Together, these techniques can be helpful for diffusing negative emotions. Option 1. Security may be called if the client appears to be losing control or is a risk to self or others. However, initially calling security or using an authoritative approach may further escalate the situation and does not address the client's concern. The nurse should initially try to diffuse the situation and the client's anger. Options 2 and 4. In both options, the client's feelings are validated, but defensive statements follow. When the nurse defends, clients are made to feel as if their opinions and feelings do not matter. These options also do not indicate that the nurse is willing to seek a solution. Educational objective: when a client is angry and upset, therapeutic communication skills such as giving recognition, validating feelings, and offering self may help de-escalate the situation. The nurse should not initially ignore the client, use threats or cite rules, or make defensive statements. The nurse is reviewing discharge teaching with the parent of a child with acute myelogenous leukemia who was admitted with varicella-zoster virus. The client has multiple lesions that have not crusted. Which of the following instructions should the nurse include? Select all that apply. Apply diphenhydramine cream sparingly to lesions after bathing your child. Keep giving your child the acyclovir at home as prescribed to fight the virus. You can give your child acetaminophen for pain and fever. Your child should receive the varicella virus vaccine in 30 days. Your child will no longer be infectious after all the lesions have crusted over. Varicella-zoster virus (VZV) infection, chickenpox, is characterized by lesions that begin as a maculopapular rash, progress to weeping vesicular lesions, and typically crust over within approximately 1 week. The lesions are often pruritic and/or painful, and clients frequently have an accompanying fever. In most cases, treatment is supportive in nature and includes cool oatmeal baths and topical antihistamines, e.g., diphenhydramine, applied to lesions for itching. Option 1. Acetaminophen is needed for fever or pain. Option 3. Immunocompromised clients, e.g., clients with acute myelogenous leukemia, AML, are at risk for severe varicella, e.g., disseminated pneumonia, and require aggressive therapy, including an antiviral agent, e.g., acyclovir. Antiviral therapy should be continued until all the lesions have crusted over. Option 2. VZV is spread via airborne and contact transmission. Clients are most infectious in the days leading up to the rash and continue to be infectious until the entire rash reaches the crusting stage. Option 5. Option 4. Immunocompromised clients should not receive live attenuated vaccines, e.g., varicella virus vaccine. In addition, the vaccine is not indicated for a client who has already developed immunity after recovering from VZV infection. Educational objective treatment for clients with varicella zoster virus infection, chickenpox, is supportive and includes acetaminophen for fever or pain, cool oatmeal baths, and topical antihistamines for itching. Immunocompromised clients are at risk for complications, e.g., severe disseminated varicella, and should receive antiviral therapy. Clients are infectious until all lesions crust over. The nurse is caring for a client with chronic pain who just had surgery and is receiving patient-controlled analgesia, PCA, morphine. The client is in severe pain, with a rating of 10 out of 10, despite receiving the maximum ordered dose. The nurse calls the healthcare provider, saying that the client is still having pain and recommending a higher PCA dose. Which nursing role is being implemented in this situation? The role of the nurse as advocate is to protect the rights of the client, including the right to adequate pain control. The nurse acting as advocate speaks up for clients when they cannot easily speak for themselves. Option 2. In the role of caregiver, the nurse promotes healing and well-being by helping the client and family set and achieve goals through the nursing process. Option 3. In the role of educator, the nurse helps the client and family learn about topics relevant to their health. Option 4. In the role of manager, the nurse coordinates the care of the client among different members of the interdisciplinary team and across care settings. Educational objective. An important nursing role is client advocacy, which involves speaking up for clients to protect their rights and improve their health outcomes and experiences. The nurse is preparing to give a heparin injection to a client who is malnourished and cachectic. Which method of injection would be appropriate for this client? When administering subcutaneous anticoagulant injections, e.g., heparin, enoxaparin, the nurse must select the appropriate needle length and angle to avoid accidental intramuscular injection, especially in clients with insufficient adipose tissue, e.g. Intramuscular injection of heparin would cause rapid absorption, resulting in a hematoma and painful muscle irritation. The nurse should administer subcutaneous injections at 90 degrees if 2 and 5 centimeters of subcutaneous tissue can be grasped, or at 45 degrees if only 1 and 2.5 centimeters can be grasped. Option 2. Anticoagulants are best absorbed if administered in the abdomen at least 2 and 5 centimeters away from the umbilicus. Option 1. A 15-degree angle is used for intradermal injections and would not deliver medication into the subcutaneous tissue. Option 3. A 90-degree injection angle is appropriate for clients with sufficient adipose tissue, i.e., at least 2 and 5 centimeters can be grasped. Option 4. Needles longer than 5/8 and 1.6 centimeters are used to administer intramuscular injections. Educational objective. Anticoagulant injections should be administered in the abdominal subcutaneous tissue at a 45 to 90-degree angle. A 45-degree angle is used for clients with minimal adipose tissue to avoid accidental intramuscular injection, which would cause rapid absorption and result in hematoma and painful muscle irritation. The nurse provides home care education to a client newly diagnosed with von Willebrand disease. Which of the following client statements demonstrate correct understanding of the education? Select all that apply. I can use a humidifier to help prevent nosebleeds. I need to avoid contact sports such as soccer or hockey. I should use a soft bristled toothbrush and floss carefully. I will call my healthcare provider if I soak a menstrual pad every hour. I will take naproxen to decrease inflammation if I am injured. Von Willebrand disease is a genetic bleeding disorder caused by a deficiency of von Willebrand factor, VWF, which plays an important role in coagulation. Intranasal desmopressin or topical therapies, e.g. thrombin, may be prescribed to stop minor bleeding, whereas major bleeding may require replacement of VWF. Clients should wear medical identification bracelets in case of emergency. Client teaching includes: notify the healthcare provider of signs of bleeding, e.g., severe joint pain or swelling, headache, especially after injury, blood in urine, stool, uncontrollable nosebleed. Use a humidifier or nasal spray to keep the mucosa moist, reducing the risk of nosebleeds. Option 1. Avoid aspirin and nonsteroidal anti-inflammatory drugs, NSAIDs. Avoid activities with a higher risk for injury, e.g., contact sports. Option 2. Maintain gum integrity, e.g., soft bristle toothbrush, gentle flossing, to minimize bleeding potential. Option 3. Report heavy menstrual bleeding, e.g., soaking a pad in less than 3 hours, which can be managed with hormonal therapies and intranasal desmopressin. Option 4. Option 5. Clients should avoid medications that can exacerbate bleeding, including aspirin and NSAIDs, e.g., ibuprofen, naproxen, ketorolac. Clients should instead use the mnemonic RICE, rest, ice, compression, elevation, to help with pain and inflammation. Educational objective: in von Willebrand disease, a genetic bleeding disorder, deficient von Willebrand factor prevents effective coagulation. Clients can decrease bleeding risk by avoiding high-risk activities, e.g., contact sports, and nonsteroidal anti-inflammatory drugs, keeping nasal mucosa moist, and maintaining gum integrity, e.g., soft bristle toothbrush. The graduate nurse cares for several post-stroke clients. Which of the following nursing interventions are appropriate? Select all that apply. Implement fall precautions for the client with cerebellar stroke. Increase lighting for the client with cranial nerve 7 affected. Initiate swallow precautions for the client with cranial nerve 6 and X affected. Place spoon within field of vision for the client with homonymous hemianopsia. Speak louder in front of the client who has receptive aphasia. Strokes cause different neurological deficits depending on the location of the affected area within the brain and the extent of injury. Cerebellar deficits affect balance and equilibrium. Fall precautions are appropriate. Option 1. Cranial nerve 6 glossopharyngeal and X vagus control the gag and swallowing mechanisms, making swallow precautions necessary. Option 3. Blindness in the same half of each visual field, homonymous hemianopsia, is suspected when clients ignore objects on one side. Initially, the nurse assists, e.g., places utensil in unaffected visual field, but the client must learn to turn the head to scan the environment. Option 4. Option 2. A stroke affecting cranial nerve 7, the facial nerve, can cause an asymmetrical smile or inability to raise one eyebrow. Increased light is unnecessary as vision is not affected. Option 5. Clients experiencing receptive aphasia, impaired comprehension of speech and writing, typically have injury to the Wernicke area of the brain, located in the left temporal lobe. The nurse would not speak louder as this does not aid comprehension. The nurse should speak clearly, ask yes or no questions, and use gestures and pictures to increase understanding. Educational objective: strokes cause different neurological deficits depending on the location and extent of injury. Cerebellar deficits affect balance and require fall precautions. Cranial nerve X and X injuries can impair swallowing, and a client with homonymous hemianopsia will not see objects on the affected side. A client with blunt head injury is admitted for observation, including hourly neurologic checks. At 1 a.m., the client reports a headache. The nurse obtains a normal neurologic assessment and administers the PRN acetaminophen. At 2 a.m., the client appears to be sleeping. Which action should the nurse take? Arouse the client and ask what the current month is. Document relief apparently obtained and recheck at 3 a.m. Let the client sleep but verify respiratory rate. Wake the client up and check for paresthesia. Serial neurologic assessments are important as neurologic abnormalities are often initially subtle, making it important to note the trend. Interventions for neurologic issues are most effective when made early. A neurologic assessment includes Glasgow Coma Scale (GCS), best verbal and motor responses. Best verbal response assesses orientation to person, place, and time. Time is the most sensitive. Pupils equal, round, response to light, and accommodate PERRLA, motor, strength and movement in all four extremities. Vital signs, especially any signs of Cushing's triad of bradycardia. Bradypnea, abnormal breathing pattern and widening pulse pressure, the difference between systolic and diastolic blood pressure readings. The nurse is assessing for signs of increased intracranial pressure, ICP. This client is not admitted in the hospital to get a good night's sleep. The client is admitted due to the need for serial neurologic assessments by a professional nurse, and that is the priority. Option 2. Although pain relief has probably been achieved, this option does not reflect any neurologic assessment. One of the early signs of increased ICP is change in level of consciousness. This option does not assess the client's arousability. Option 3. Checking the respiratory rate and characteristics is part of the neurologic assessment. However, this alone is insufficient for assessing a neurologic status after a blunt head injury. Option 4. It is good to awaken the client, but paresthesia is part of a neurovascular assessment. Neurovascular assessment, commonly known as the 5 petaseconds, consists of paresthesia, pain, pallor, paralysis, and pulselessness. A neurovascular assessment is used when circulation is a primary concern. It is not the primary neurologic assessment needed in a closed head injury. Educational objective clients must be awakened for a prescribed, necessary neurologic assessment. A neurologic assessment consists of GCS PERRLA, movement and strength of the extremities, and vital signs. A client is transferred from the post-anesthesia recovery unit to the surgical unit following an open cholecystectomy. Which interventions are most important for the nurse to perform to prevent postoperative pneumonia? Select all that apply. Administer morphine only if the pain is greater than 8 on a 1 to 10 pain scale. Ambulate within 8 hours after surgery, if possible. Have client cough with splinting every hour. Have client deep breathe and use the incentive spirometer every hour. Maintain pneumatic compression devices when client is in bed. Place client in Fowler's position. Strategies to prevent postoperative pneumonia include the following. Adequate pain control is a priority so that the client can move, deep breathe, and cough more effectively and comfortably. Opioids are effective for relieving postoperative pain, but because they depress respirations and the cough reflex, assessing the client's response to the medication and level of sedation is important. Ambulate within 8 hours after surgery, if possible. Mobilization. Early ambulation decreases atelectasis and hypoventilation, and promotes coughing, deep breathing, and lung expansion. Usually, it can be initiated within 4 to 8 hours after surgery. Coughing with splinting every hour. Splinting of the incision and adequate pain management are useful for promoting an effective cough-huff cascade that clears the airway of secretions. Deep breathing and use of the incentive spirometer every hour. Deep breathing in conjunction with the use of the incentive spirometer promotes ventilation and oxygenation. It opens the pores of cone that permit air from well-ventilated alveoli to move into collapsed alveoli. and it helps to prevent decreased atelectasis and hypoventilation caused by the effects of anesthesia, analgesia, and pain. Place in Fowler's position. Elevating the head of the bed 45 to 60 degrees helps to promote oxygenation and prevent aspiration. Turn and reposition the client at least every 2 hours. Swab mouth with chlorhexidine swabs every 12 hours. Mouth care prevents ventilator-associated and postoperative pneumonia. Use hand hygiene, all personnel to decrease transmission of microorganisms. Option 1. Adequate pain control is a priority. The decision to hold opioids is usually based on sedation level. Giving pain medicine only for severe pain is not appropriate. If the client is awake and complains of pain, adequate analgesia should be provided, oral or IV. Option 5. Use of pneumatic compression devices promotes venous return and helps to prevent venous thrombosis, not pneumonia. Educational objective strategies to prevent postoperative pneumonia include adequate pain management, positioning, coughing and deep breathing, mobilization and early ambulation, twice daily chlorhexidine mouth care, and precautions for limiting the transmission of microorganisms. A client with a C3 spinal cord injury has a headache and nausea. The client's blood pressure is 170/100ths of a millimeter Hg. How should the nurse respond initially? Administer PRN analgesic medication. Administer PRN antihypertensive medication. Lower the head of the bed. Palpate the client's bladder. Autonomic dysreflexia is an acute, life-threatening response to noxious stimuli, which clients with spinal cord injuries above T6 are unable to feel. Signs and symptoms include hypertension, bradycardia, a pounding headache, diaphoresis, and nausea. It is essential that the nurse assess for and remove noxious stimuli to prevent a stroke. Option 4. Noxious stimuli may include bladder distension, e.g., obstructed urinary catheter, neurogenic bladder, fecal impaction, tight clothing, e.g., shoelaces, waistbands. Options 1 and 2. Hypertension, headache, and nausea due to uncontrolled sympathetic activity will resolve once the cause is identified and removed. Option 3. Lowering the head of the bed would increase blood pressure. The head of the bed should be raised to lower the blood pressure. Educational objective: autonomic dysreflexia is an acute, life-threatening response to noxious stimuli, e.g., bladder distension, tight clothing, in clients with spinal cord injuries above T6. Signs and symptoms include hypertension, bradycardia, a pounding headache, diaphoresis, and nausea. The nurse must immediately identify and remove noxious stimuli to prevent a stroke and resolve symptoms. The school nurse assesses an 8-year-old with a history of asthma. The nurse notes mild wheezing and coughing. Which action should the nurse perform first? Assess the client's peak expiratory flow. Call the healthcare provider, HCP. Educate the client about avoiding triggers. Notify the client's parents. Symptoms of an asthma exacerbation include wheezing, chest tightness, dyspnea, cough, may be nocturnal, dry, or productive, and retractions. A cough is often the earliest sign of an asthma exacerbation in children. Bronchospasm leads to CO2 trapping and retention. The bronchospasm forces the client to work harder to exhale and the expiratory phase becomes prolonged. The nurse needs to further assess this client to validate the severity of the exacerbation before implementing an intervention. By assessing the client's peak expiratory flow, the nurse can determine the severity of the symptoms. The nurse will also need to assess the client's respiratory rate and lung sounds. Option 2. Additional information is needed before notifying the HCP to determine the severity of the client's current condition. Options 3 and 4. The client's parents do need to be notified and discuss asthma triggers with the nurse. However, these are not a priority as the client is currently symptomatic. Educational objective: the nurse must determine the severity of a client's condition before implementing an intervention. By assessing this client's peak expiratory flow, the nurse can determine the severity of the asthma symptoms.